This is another interview with Dr. Thiti. This is concerning liposuction and body sculpturing. So, Dr. Thiti, can you please explain to me which procedures you do in terms of liposuction, because there's many different types?
Yes. Normally, I do for the liposuction. I love to use the combination because I think I found that every tools, every machine there's some a little bit different benefit. Like I use phasers, that is ultrasound assisted liposuction. The phaser actually is good for remove the fat from the surrounding tissue, so it's less traumatized, and we can remove fat quite a lot from the phasers. The other thing that I use is body tight. The body tight is a RF assisted liposuction. The RF actually is like a heating, so it can contract the septums, and it contract the collagen and heat protein to shrink down the skin. That means it can help to shrink the skin, then recovery faster than normal liposuction.
Okay.
So actually I use combined. Some might need to use body type, some might need to use the phaser. Yes.
So which areas of the body are particularly good for liposuction?
Actually, we have to know that the fat especially fat around the belly, normally have two components. One is fat around the abdominal walls, and the other is fat around the visceral organ, with the viscerals. If the muscles is weak, it got the bulgings. It's come from the fat around the viscera. That we can do nothing about that. The fat that we can touch is fat around the abdominal walls. That means fat around above the muscles, and also fat around the other places like arms, back, thigh.
So, Dr. Thiti, can you explain, please, what preparations, if any, would a patient need to make before coming for surgery?
At first, actually, we need to evaluations. Actually, if I got some picture before, it might be better, because if the skin is too much stretching, then liposuction alone can do nothing. If we do liposuction, the skin will be shrink down and look like aprons, and it will look very awkward. So that cases we need to do like tummy tucks to cut the skin out. So we need to check that you're fit enough, you'll be candidate for the liposuction or not. And then, because this is a little bit traumatized, it bleeding easily, so we need to stop some medication that might cause some bleeding easily, like aspirin. Might be at least 2 weeks before surgery.
I've heard some surgeons do stitching of the muscle.
Yes, but actually, I stitch the muscles also, but actually that means a little bit scar. So they have some. Normally, if you're sewing the muscles, normally in that condition, sometimes we cut the skin together. That we call might be full tummy tucks or mini tummy tuck plus the skin muscle tightening combined with the liposuction.
So, how long would a patient need to stay in hospital?
Well, because if they just do liposuction, the patient will be not so much discomfort. So actually, just only one night is okay. But if you have to sewing the muscles or you need to do the tummy tuck, it may be a little bit discomfort, especially when you try to walk. The muscles will be stick together, and it's tough for you try to ambulate. In that case, we need to stay around 2 to 3 days in the hospitals.
And how long would you suggest they stay in Bangkok after such surgery?
For the liposuction, it might be very, very fast. Normally, it might be 1 week after surgery. That's enough. But for the tummy tucks, it should be at least 2 weeks before they leave to Bangkok.
And once they do return home, obviously, like you said, there's trouble with walking, and there could be trouble with other because of the amount of
Yeah.
tissue removed, how long would you suggest they stay off work or they stay off activities like the gym?
If the liposuction, actually, we didn't touch the muscles, as I told you. So actually, it depends. If they feel no pain and they feel to go back to activities, I think after a week you can go back to activities, normal activities. But for the tummy tucks, because we saw the muscles, and at first the muscle was stick by the sutures. We need time for the scar formation, for make the muscles stick together. That's supposed to be roughly around 2 months. So I wait for 2 months to allow the patient to back to the normal activities and do this exercise for that. But one thing that I have to tell you about the liposuction is the result. Because when we do the liposuction, when we remove the fat, then there still have some space underneath the skin. At that time, the serums will be take the space instead of the fat. So at first, after surgery, you might find nothing. It will be swelling the same. Some might be even more. But after that, the serum will be absorbed in the circulation day by day, and you see the result. Normally, the earlier that you can see the results is roughly around 3 weeks, and then you can see more definite within 3 months. The maximum recovery is roughly around 6 months for the liposuction.
Thank you very much.